I thought I'd just close with two vignettes of patients, which I think makes the point rather nicely that I'm trying to make. One was a man who'd become acutely depressed. He was very agitated, he couldn't sleep, he couldn't eat, he'd lost weight, he was filled with depressing thoughts about himself, full of self-hatred really, but it had come on rather acutely, so this was more like, in a way, an episode. And the cause, the proximate cause, was that his girlfriend had left him, and worse than that, she'd formed a relationship with a very close friend of his. And you can imagine how difficult this would be for anyone to manage, but this man managed it very badly. He started psychotherapeutic treatment with a young woman that I was supervising. Within about 3 weeks of treatment, he was much better. Within about 6 weeks, he was very much better indeed. And he filled all the sessions with accounts of his new relationship and how wonderful this woman was that he'd met. She was currently married to someone else, but she was going to leave that man for him. And the therapist reported how when he filled the sessions full of these accounts, she often felt she had nothing to do or nothing to say. In fact, when she thought about it, she said she felt rather excluded and unimportant. So one could see what's happened here, can't one, if one thinks about it. This man's depression has been cured. So what seems to have happened is the patient has managed his very disturbed state through instead of being left by a woman who's left him for someone else, he's found a woman who will leave someone else to come to him. So one can say that there's a structure, that is two people together and one person who's left out. When he came for treatment, the person left out was obviously him, and he was in a very dejected and persecuted state, feeling, in a sense, having to observe this happy couple who have now living a happy life, and him totally abandoned. But within a few weeks of treatment, he's now a member of this happy couple. He's now with a woman, and the excluded person is now the woman's husband, but also, of course, his therapist, who felt she had nothing to do and felt excluded. So one can see the way that kind of two people together and one person left out is the same. One way of putting it is, it's still the same, the furniture's the same, that is, say 3 chairs, 2 occupied by people who are together and one person excluded. It's just that everyone's changed seats. So that kind of solution to a problem, very natural, but is very, very precarious, because he hasn't solved the problems that necessitate life to be lived in this way. What he needs to find is a life where he could bear being excluded and not have to live in relationships in which there's always someone excluded. So that would be now what I wanted to emphasize there was, if after 2 weeks of treatment, when he was now having the new affair, if you'd done a symptom inventory, you'd say, oh well, that's very good, 2 weeks psychotherapy has cured him. But we would say that's meaningless. He's in a manic state. He's cured his symptoms not by facing them, but by denying them. That's a fragile solution, and he remains highly vulnerable. He needs to stay in treatment so that gradually he can come to really face and understand himself in a different way. The second vignette I wanted to just mention is, I remember this case very well. A woman came for an assessment consultation. The way we do consultations, we tend not to ask lots of questions. We tend to just start with whatever a person brings. So this person who'd been referred, and she'd had various treatments for depression, she arrived for the meeting, sat down, and in a rather detached, slightly deadened way, started the meeting by giving me her history. That is, she's been depressed for so long, the depression manifests itself in this way, she has difficulty sleeping, she can't eat, She has gloomy thoughts most of the time, how long she's had it, how it affects her life, what treatment she's had. You could say, well, that's very helpful. And in a way, yes. In fact, I knew all that already from the referral letter. But what I did notice was that she talked in such a way as if she was describing some patient, not herself, who was suffering from various problems. And it almost felt to me as if she might hand this person over to me. I might, so to speak, apply my psychiatric stethoscope and examine her, make a diagnosis, tell her what treatment she should have, and then she'd take the treatment that I'd offered her, without having to be involved at all in anything of emotional meaning to her. So, at some point, I said something of this to her, and I said it was as if she presented herself in this kind of state where she, as if she's a kind of object to be handed over to me, for me to make a diagnosis and me to treat her without her having to participate at all. At that point, the patient started to sob and said, "I don't think I've participated in anything in my whole life." Paradoxically, of course, she was now participating, but in a way that was disturbing to her and to me. But the interview was now much more alive. Now, the point that I make is that one only could get to grips with the nature of the difficulties by understanding the way the person actually, the kind of relationship the person forms in the room. The trouble is that someone like that, in a different context, who can give such an accurate account of all her symptoms, someone might just tick all the boxes and say, okay, well, you have this treatment and off you go. And I'm saying that's colluding with the self-alienation of the individual, which is part of the difficulty that they're having. And you need time, space, and some training in order to get past that. And of course, that person who would have fulfilled the diagnostic criteria for depression and was depressed had been depressed for most of her life. But partly, the depression was manifested in her way of her alienation from life and never feeling that she could participate in the various complicated factors in her early life, which I won't go into because that's not really the point that I'm making, that have resulted, that were causal factors in her ending in this state. But she was someone who we were able to help. Before I close, I just wanted to say a little bit more about the TAD study, because I don't think I quite described it accurately enough. It was a study that went on for 10 years. Patients received 18 months of psychoanalytic psychotherapy and then were followed up for 2 years after the end of psychotherapy. And roughly, so I've written it down for myself, nearly half of the patients saw major improvements 2 years after the therapy had ended. So that's a very, very significant finding. And there are more other significant findings. Not all the patients got better, of course, that never happens in this field. But that is a very, very significant finding. And there's quite the fact that the methodology of the NICE guidelines didn't allow that, the kind of thinking and the kind of model, and was restricted very much to what I call the event model, a very constricted medical model, excluded those kind of findings. That, I must say, has now been very robustly challenged by some very, very major stakeholders, including the Royal College of General Practitioners, psychiatrists, well, I won't go into this, but many, better way of putting it is, many of the leading professional organisations involved in the care of psychiatric patients have protested, and the protest has been taken seriously, and the guidelines are currently are being revisited in terms of looking at the process through which they were reached. So, and I think that's very, very important, and I hope the pressure can be kept up so that it's not only that this study can affect the guidelines, which of course it should do, but it also, the model of thinking which this study represents, it's so important that that gets into the thinking of the way the way we think about mental illness and psychiatric disorder in general, which I hope in this talk I've managed to convey.